Hi there, I'm Penelope Edwins. I'm a neuropsychologist. Well, I'm filming outside again today. That's because we're talking about depression or major depressive disorder, if you may. So why am I outside in the sun? That's because sunshine is one of the crucial issues or one of the crucial elements that can assist in alleviating some of the symptoms that cause major depressive disorder. So what are the different types of depression? Well, firstly, we have major depressive mood disorder, MDD, where we just feel a deep sense of sadness. And the next type is chronic major depressive mood disorder. That's when the same feelings of deep sadness go on for a very, very long time, for months and years, in some cases. And the other type is medication or substance induced depression. As the name lends itself, it is depression that's often caused as a side effect of medication or as a result of having taken substances, drugs, or anything, or alcohol, or anything like that. So, depressive mood also comes with some subtypes. For example, postpartum depression. And this is when women often feel just deeply sad and unable to connect with their babies, their newborn babies. And this often happens 4 weeks following the birthing process. So we're not talking about baby blues. I'm talking about a severe, deep, long lasting depression long after we've given birth. And there is still just that deep sadness and inability to take care of your own child or be a part of raising your child or be excited about having your child. And the other type is called SAD, and that is seasonal affective disorder, and SAD for short. And that's often encountered during the winter months when everything is dark and gloomy and there's no sunshine and bright blue skies like we have today. And people often feel just depressed and just very sad because of their surroundings during the winter months. And that's brought on by the changes in the season. But how can we tell that we're depressed? Or how can we tell by observing our family members that something is not quite right, And this is important to be able to identify some physical symptoms that we can see and observe, so that we are able to help those around us who, because often when patients are depressed, they're unable to help themselves. They rely on their loved ones or those around them to be able to say, something is different about you. Maybe you need to go and seek help. So, what are some of those physical symptoms that we can easily identify to be able to help our loved ones? Well, first one is suicide ideation. Often the person will talk about just committing suicide or not being around anymore and how life would be much better without them, etc. Please pay attention when that happens. That person needs help immediately. If they don't help themselves, please seek help for them or on their behalf, get somebody to intervene. Another observable symptom that you can watch out for is anhedonia, what we call anhedonia. That's something where, or a symptom where a person just lacks interest in anything, in everything, even previously loved activities, and they just no longer have the enthusiasm or the passion and the love that they had before to play soccer or play with their dogs or their animals or go out with friends or socialize with family and friends. So there's another sign that we can look out for. Another one is psychomotor retardation. What is that? That is the cognitive slowing down or slowing down of cognitive functions. But the way we can observe it in somebody's behavior is by slow movements. The person would move slowly because the processing speed in the brain, or the speed in which they process information, has slowed down due to depression. And this is the one symptom that people don't often recognize or don't often associate with depression, but it's a crucial one that leads us into thinking that something may be wrong there. The person is just looking lethargic and moving slowly. Another symptom or observable sign that you can look out for is apathy. That's just lack of enthusiasm, lack of interest, lack of determination to do anything, or goal-oriented behavior where they just don't have any goals, no passions to wake up and do anything or just participate in anything. Right, so what causes depression or depressive mood disorder? One of those things is stress, and this is something that runs as a common thread amongst most neuropsychological disorders, or just psychological disorders or mental disorders. Often stress is central to most of them. Equally with depression, when we are stressed or exposed to prolonged episodes of stress or stressful events, we tend to feel depressed. That's because when we are stressed, the brain secretes higher levels of cortisol. And cortisol causes in us to feel anxious and highly strung. And then we feel depleted after that and just very, very sad and in a low mood. All right, what else causes stress? Traumatic events such as accidents, injuries, that may happen suddenly, and your life changes, and you have no coping skills or ways or time to even deal with the unfolding events. And that often causes us to go into a very low, sad mood. Another important factor is hormonal changes, often with women when they go through different stages in life, pregnancies, menopause, and hormones such as estrogen, progesterone are all affected, or the levels that the body is able to create or secrete is low. Then that also contributes to to depressive mood. Another one of those is like sudden changes in emotional status, or just emotional losses like death. The type of events that occur suddenly, that are unexpected and unforeseen, they often lead to depressive mood as well. Another very important factor that contributes to depression is lack of good quality sleep. Um, so rapid eye movement sleep, which occurs between 9 o'clock and 2 a.m. So it's crucial to make sure that you are asleep at those hours, because your brain requires that type of sleep, that level of deep sleep, to be able to clear memories, for example. So you are not caught up in loops where you're constantly reminded of the events that caused the sadness in the first place. And the only time your brain is able to rejuvenate and repair itself is during the rapid eye movement sleep, or REM sleep. And make sure that you're sleeping for long periods of time, for 8 to 10 hours of sleep, to allow your brain to repair itself in the brain. I've just listed environmental factors now that contribute to the causes of depression, but what happens chemically in the brain that makes us feel or experience low mood? Well, there's an enzyme called monoamine oxidase, which, when secreted in high levels, or when there's high levels of it in the brain, it breaks down key neurotransmitters that are meant to keep you feeling happy and interactive and motivated, etc. So, what are these key neurotransmitters? Serotonin, dopamine, and norepinephrine. And unfortunately, most research is focused on just serotonin levels as a contributing, or low levels of serotonin as a contributing factors that cause depression in the brain. However, they've overlooked, or there's limited studies that highlight the other neurotransmitters, which are dopamine and norepinephrine. So, I'll come back to serotonin now, but let's first discuss dopamine. Why is dopamine so important when we're talking about depression? As I've listed in the different types of depressive mood, where some of the symptoms, psychomotor retardation, and just slow processing speed of information in the brain, that's often associated with low levels of dopamine. And that's one of the crucial symptoms that you would notice when somebody experiences chronic depression or dysthymia, as I've explained earlier. They often walk slowly, think slowly, react slowly, respond in a slowed manner. And dopamine would be a key neurotransmitter that's low in that particular case. And the other neurotransmitter that's quite important is norepinephrine. Norepinephrine regulates our body temperature, our sleep patterns, our wake sleep patterns, our fight flee responses. So dopamine is crucial in maintaining levels of stress or perception of what a stressful event actually is, if a particular circumstance or situation is stressful or not. And irregular levels or low levels of norepinephrine mean that the reaction or the response would be not so accurate, and therefore our stress levels would be high, and that's one of the contributing factors that lead to depression in an environmental situation, as I've stipulated before. So those two are also quite as important as serotonin levels. So what is serotonin exactly? Serotonin is one of those happy hormones that are or neurotransmitters that are often created by sunshine. And this is why I'm outside today, because sunshine is one of those factors that increase the creation or the production of serotonin in the brain. So walking outside, walking your dog, walking your children outside mean that your serotonin levels would be increased and you will feel much better after a lengthy period of time out in the sun. As you know, when the sun's out, we feel better. And I said earlier, I mentioned earlier that it's unfortunate that serotonin levels have been the only ones that have been highlighted, or low serotonin levels have been highlighted as the main contributing factors for depression in the brain. But I say that because the main treatment of depression has become antidepressants or dispensing antidepressants to patients. So what happens in that case is that your doctor or psychiatrist will prescribe an antidepressant for you to take to supplement or increase the levels of serotonin in your brain. Now, how does this happen? What happens in your brain is that you've got neurons that contain neurotransmitters in them. But these neurons fire the neurotransmitter onto another neuron, which then absorbs the chemical or neurotransmitter and passes it on and fires it on to the next um, neuron. But what happens in the case where you're taking antidepressants which contain serotonin, selective serotonin reuptake inhibitors, SSRIs, that's what is contained in antidepressants. What happens is that the SSRIs, as the name suggests, they inhibit the next neuron's ability to absorb serotonin that's been fired by the first neuron. So the first neuron will fire the neurotransmitter serotonin, but the second or the next neuron that's meant to absorb or reuptake serotonin and pass it on right through to all your brain regions doesn't do that. So they inhibit that ability to do that, allowing for excess serotonin to be available in the brain. And that's how doctors or pharmaceuticals have taken that approach to try and maximize production of serotonin levels or increase levels of serotonin in the brain by inhibiting the reuptake of serotonin. But as I said earlier, the problem with that is that there are other neurotransmitters that may be playing a role in depression, which is why we end up with conditions such as um, what we call treatment-resistant depressive disorder. So that means that a person has been on antidepressants for years and does not respond to treatment the way that is expected, or the depression has not subsided in any other way. That's because they're probably not addressing the correct neurotransmitters that are missing in the brain. As I said, they're probably only focusing on just serotonin. So please be very careful. Speak to your psychiatrist, speak to your treating doctor, and find out, or just explain to them that you may be interested in finding out what are other causes of your particular depression. can we do to eliminate some of the depressive symptoms? One, walk out in the sun, play in the sun, exercise in the sun. When we exercise, we secret, we increase the levels of dopamine in the brain. If you do it in the sun, doubly so, you also increase serotonin levels. But also when your muscles contract, they release endorphins in your brain. They also help you feel good and happier. Get enough sleep, good quality sleep. Rapid eye movement sleep that you get between 9 and 2 a.m.